Hello, my name is Ella Green, and today I'm going to be presenting on autism spectrum disorder and gender diversity through USF. Autism spectrum disorder can be described as difficulties with social interactions and social communication, in addition to the presence of repeated and restricted behaviors. And while this definition gives us a general understanding of what autism spectrum disorder is, it's important to recognize that the autism spectrum is vastly diverse and that each individual experiences autism spectrum disorder differently. Even though more people are being diagnosed with autism spectrum disorder in recent times, it's estimated that the true prevalence of autism spectrum disorder is relatively stable. So, because this is a known community with unique needs, it's crucially important for our institutions like schools, healthcare, and our communities to offer specialized services and support for this underserved community. When considering this diverse population, we must acknowledge the significant intersection of gender diversity. Enough is known about the experiences of autistic individuals across the gender spectrum to understand that gender affirming care is not a minor issue. Requiring a basic understanding of gender diversity can reduce stigma and discrimination against this intersecting population, and gender affirming care has shown significant positive impacts on mental health outcomes, especially for youth. Taking this into consideration, understanding the experiences of autistic individuals across the gender spectrum is crucial for developing more inclusive and affirmative support services. First, I wanted to address the biological sex-based differences that are crucially important to consider when diagnosing and treating autism spectrum disorder. It's common knowledge that males are more likely than females to be diagnosed with autism spectrum disorder, and because of this, the diagnostic criteria and the diagnosing processes for autism spectrum disorder is geared towards biological males in a way that can create a delayed diagnosis and causes other effects on females with autism spectrum disorder. An article from 2019 written by Renee Green and colleagues in 2019 describes how women are more likely to have prosperous social lives, better social communication and social interactions than males with autism spectrum disorder. And because of this, there can be confusion or delays in the diagnosing process. In addition to this, females with autism spectrum disorder are more likely to mask their symptoms, and their symptoms can appear more along the lines of perfectionism than their male counterparts. Because of this, it's important to address the biological and sex-based differences within the autism spectrum disorder community to understand how the timeliness of diagnosis can affect females with autism spectrum disorder and how it increases the prevalence of internalizing disorders like anxiety and depression due to going long periods of time without adequate support. Gender diversity describes the range of gender identities that naturally occur as part of human variation. The majority of the population worldwide is cisgender. We have the definition here. It's someone whose gender identity matches the sex that they were assigned at birth. And then we have the definition of transgender and gender diverse, which can be abbreviated as TGD. This would be someone whose gender identity does not match the sex that they were assigned at birth. Now, this is a pretty broad umbrella term or umbrella category. And so under the category of transgender and gender diverse are many other identities such as agender, non-binary, and transgender. So for the purpose of this presentation, we'll use transgender and gender diverse to describe all of these identities. However, sometimes this can be a harmful thing to do in research or in practical applications because there's a lot of nuanced differences between these gender identities, and it's important to recognize each one and how it's going to affect each individual. This information reflects the largest study that investigated the overlap between autism spectrum disorder and gender diversity. So this study investigated over 640,000 individuals, and the results showed that among the transgender and gender diverse population that they studied, approximately 24% of those people also had autism spectrum disorder, as compared to 5% of the cisgender population. So Because this is a known intersection, it's important to be knowledgeable and mindful of the specific considerations necessary for this population in different settings. The next part of this presentation argues that recognizing gender, whether that be acknowledging the differences in male versus female expression of autism spectrum disorder, providing specialized gender-affirming care for trans and gender diverse people on the spectrum, or speaking respectfully and knowledgeably about gender diversity to patients is absolutely necessary in providing comprehensive support services to people with autism spectrum disorder. In terms of receiving specific care for gender-based needs, gender-affirming care is a term that refers to any type of intervention that supports and affirms a person's gender. For some people, this could look like counseling to outwardly present in a way that aligns with their gender better, speech training to sound more masculine or feminine, or body modifications like hair removal or chest binding. These interventions negate gender dysphoria or negative thoughts and emotions rooted in an incongruence between perceived and desired gender. Understanding the different types of treatments available to trans and gender diverse people can help debunk some of these outlandish claims about the types of gender affirming care that are available specifically to children, and can help contribute to maintaining the availability of gender affirming care for everyone. As follows, hormone therapy is another type of gender affirming care available to transgender and gender diverse people. So for adults, this could look like hormone replacement therapy, which increases the development of secondary sex characteristics more similar to one's gender identity, where on the other hand, puberty blockers could be available to trans and gender diverse youth, specifically prepubescent children, to halt the development of secondary sex characteristics. A report published in 2022 by Patrick Boyle through the Association of American Medical Colleges summarized that adolescents with early access to gender-affirming care reported decreased mental health disorders such as suicidal ideation, and they also reported lower rates of substance abuse disorders versus their peers who only had access to this type of care later. Some people will claim that trans and gender diverse people with autism spectrum disorder should not have access to gender-affirming care, and they'll make claims that people with autism spectrum disorder have ability to deception. However, this isn't true. A study conducted by Trapani and colleagues in 2020 was the first study of its kind to investigate autism spectrum disorder symptoms and their overlap with detecting deceptibility. So by evaluating autism spectrum disorder traits like empathy quotient, executive functioning, and theory of mind, the study found that people with higher levels of these symptoms were actually less susceptible to deception. We believe this happened because people with autism spectrum disorder tend to rely less on social cues and then are less likely to over-rely on deceit through misleading social cues. So this argument holds significant weight as worldwide debates threaten trans and gender diverse individuals' rights and availability to gender-affirming treatment. Furthermore, limitations in research inhibit the development of specialized services for this intersection. So a meta-analysis by Kalatsanaki and Williams in 2023 evaluated over 1,000 small studies of autism spectrum disorder and gender dysphoria, and they unfortunately found that many of these small studies were compromised by a small sample size, self-reported measures which can be generally unreliable, and they also had unreliable methodology because there is an absence of tools to assess for gender dysphoria as it relates to autism spectrum disorder. To that argument, in 2023, a team ran by John Strang and other experts in the field developed a tool for trans and gender diverse people with autism spectrum disorder that specifically addresses communication needs and talking points for the needs and challenges that come along with being both trans and gender diverse and having autism spectrum disorder. These standardized tools are particularly helpful for laying the foundation for issues that need to be addressed. This specific questionnaire, called the Gender Diversity and Autism Questionnaire, has 51 items on the assessment and asks questions about how an individual feels about their identity and includes challenges and problems that they may face, like according to their identity. While some people will argue that gender-inclusive care is not the primary need of those with autism spectrum disorder, evidence confirms that gender-affirming care is necessary as part of a hierarchical approach to addressing trans and gender-diverse individuals with autism spectrum disorder's needs. As a study by Eckes in 2023 underscores the importance of early intervention through applied behavior analysis, or ABA, as it promotes cognitive functioning, adaptive behavior, and social emotional development, which are key deficits as part of autism spectrum disorder. Trans and gender diverse youth are at a higher risk for anxiety, depression, and suicidality versus their cisgender peers, according to a study by Whitland in 2023. Trans and gender diverse people are particularly vulnerable to the triggers of minority stress, which include family rejection that often leads to homelessness, peer victimization, which includes rejection and bullying by peers, and discrimination, which can manifest in denial of opportunities both in school and in the workplace. Another implication of addressing gender diversity as it relates to autism spectrum disorder is reduced discrimination and stigma in the field of healthcare. Healthcare providers are often uninformed about the intersection of trans and gender diverse people and autism spectrum disorder identities, so this population experiences high levels of barriers in accessing and utilizing care, according to Green in 2025. As previously mentioned, trans and gender diverse people with autism spectrum disorder can have difficulties self-advocating, especially when it comes to gender-based care. So this includes difficulties with explaining their gender to others, correcting pronouns, and advocating for desired treatment. So understanding the specific vulnerabilities of trans and gender diverse individuals with autism spectrum disorder to minority stress and the positive impacts of gender-affirming care on mental health is paramount. Additionally, systemic barriers in schools contribute to the stigmatization and discrimination of trans and gender diverse students with autism spectrum disorder. But incorporating inclusive and supportive services in schools would help these students feel more comfortable, accepted, and understood in the school setting. So by allowing educators to teach about historic oppression, bias, and discrimination, having detailed trainings on the differing needs and about minority stress for these populations would improve the students' overall well-being. In addition to this, safe spaces like clubs, sports, and other community events can provide support for school-age children where trans and gender diverse students and students with autism spectrum disorder can find a sense of belonging. As someone who's likely to pursue a career related to mental health and LGBTQ+ topics, I felt a responsibility to learn about this intersection. This knowledge, considering my future endeavors, is invaluable for incorporating and providing competent and affirming care into my future practices. In addition to this, I have had negative experiences in the field of healthcare, and because of this research, I've solidified my commitment to contributing to a future where healthcare is accessible, affirming, and equitable for all individuals regardless of identity. Ultimately, this paper advocates for systemic change across various settings, as the stakes for receiving adequate care are all too often life or death. Institutions like healthcare and education are important starting points for fostering this greater understanding, acceptance, and support of trans and gender diverse individuals with autism spectrum disorder. By implementing standardized assessment tools, healthcare providers can start to negate some of the communication difficulties associated with autism spectrum disorder and improve diagnostic techniques and the allocation of services. Providing comprehensive training for professionals and establishing inclusive policies in schools can help counteract any minority stress and improve the mental health of trans and gender diverse youth with autism spectrum disorder. So by prioritizing education, tolerance, and research, we can work towards creating a more equitable and affirming environment for this underserved population.